us if you hear anything going on.
All right, we are live.
All right, good morning, everyone. I'm forgetting, is today May 7th? It is.
Yes.
So welcome to a joint meeting for Senate Health and Welfare and House Healthcare. It's good to see you all. And someday we'll be not at a distance, but maybe able to actually communicate more effectively, but it's been working pretty well. So this morning, we have two different proposals to look at, and they both relate to telehealth. One relates to the closure of the gap between the emergency and when other effective dates take place. And then, as we talked about the other day, and the other is a new proposal that I worked on with Jen Carby, Maria Royal yesterday. And so we'll talk about that because I think it is something that you may want to look at. In each case, the people who are testifying today from VPQHC and others, I think will be very interested in both proposals. So we've got you folks on our agenda as well, and I thank everyone for being available. So let's start out, Jen, with the proposal that you have first. And I think is it up on our webpage now? Should be. Okay.
Yes, it is. Nellie posted.
All right, great. So let's go to that.
And do you want that posted on the screen? How do you want to handle this?
Yeah, if you can post it on the screen, let's do that very briefly while you go through it, and then we can take it down as we discuss it and listen to our testimony.
Okay, I think that would be something from
Nellie, can you do that?
Nellie.
Yes, let me just pull it up. Give me 1 second.
Terrific. So this is draft 1.1, Jen?
This is draft 1.1.
Okay.
Great. Thank you, Nellie. So Jennifer Carby, Legislative Counsel. So this is some language for a potential draft bill, committee bill from the Senate Health and Welfare Committee. It would do, as you can see in the statement of purpose, it would do two things. It would move up the effective date for health insurance reimbursement for healthcare services delivered by store and forward means. And it would direct the Department of Financial Regulation to convene a working group to develop recommendations on health insurance and Medicaid coverage of healthcare services delivered by telephone after the COVID-19 state of emergency ends. So I've titled it an act relating to, it should be access to healthcare services delivered by telehealth and telephone. I'll make that change in my actual document as we go along. And then if you can scroll down for me. So thank you. So the first thing that this would do in section 1, it would be to amend the effective date from Act 91 for the store and forward piece. So if you remember in Act 91, which was H742, the COVID-19 response bill that you worked on, in the effective date section, almost everything in the healthcare parts took effect on passage, except that the specific subsection on coverage of healthcare services delivered by store and forward means was to take effect on January 1st, 2021. This would move that date up to May 1st, 2020. So that would be consistent with the date provided in DFR's emergency rule for that applies to store and forward, which has already happened. So you'll see there's a retroactive effective date for this to make this change. But this would have the store and forward start on May 1st, 2020 and continue on. It wouldn't potentially end somewhere between the end of the state of emergency and January 1st, 2021. And the reason why this may be important to do is because the existing language of the statute on store and forward is permissible, and it allows insurers to reimburse for store and forward only for teleophthalmology and teledermatology. So in order to have provisions that make reimbursement much broader than that for store and forward, and to really authorize the reimbursement of healthcare services delivered by store and forward more broadly than teleophthalmology and teledermatology, it makes sense to move the date up to May 1st when it took effect in the DFR emergency rule and leave it there. Do you want to go down to section 2? Section 2 would create a working group. This is kind of beginning language, so you may want to make changes to who's in it or what they're looking at, but this at least gets the idea out there. This would direct the Department of Financial Regulation to convene a working group to develop recommendations for health insurance and Medicaid coverage of healthcare services delivered by telephone after the COVID-19 state of emergency ends. And so on the working group, at least to start, I put representatives of DVA because of the Medicaid aspect, also representatives of health insurers, the Vermont Medical Society, Bi-State Primary Care Association, the VNAs of Vermont, the Vermont Association of Hospitals and Health Systems, the Office of the Healthcare Advocate, and other interested stakeholders. So you may decide to take people on or off, but that at least gives you a list to start with. And then I had the recommendations coming back by December 1st. Again, just starting with a date, you can change that, and it would have DFR provide to the House Committee on Healthcare and the Senate Committees on Health and Welfare and on Finance the working group's recommendations for ongoing coverage of healthcare services delivered by telephone. And then finally, we have the effective dates. So for the first part on the store and forward, I made it a retroactive effective date as though you had put the May 1st date in when you passed Act 91. So notwithstanding a provision of law that says everything takes effect prospectively, this would have the section 1 of this bill or this act, that effective date for store and forward, take effect on passage and apply retroactively to the date of passage of Act 91, and the remaining sections would just take effect on passage.
Okay, thank you, Jen. That looks good. Looks like a good start. I have a question on the effective dates before we take it off the screen. Given that I understand that at least Blue Cross and Blue Shield needed time to put store and forward in place, will retroactivity affect them in any way, have a negative effect on them in any way?
So the retroactivity here is for changing the date, the effective date to be May 1st. So it's effectively going back into Act 91 and making an effective date for store and forward of May 1st instead of an effective date of January 1st. So I think everybody was in compliance with the DFR date of May 1st. So this would just make that consistent.
Yeah, my glitch. We're good.
I understand. It's a little confusing.
It's confusing.
It's a round the barn way of getting to there, but it works.
Okay. All right. So unless we need to leave it up there because we can't scroll it up and down, and we do have it on our iPads or computers, Nellie, why don't we take that down? And then questions from folks. I see Senator McCormick's hand is up.
Thank you. Yeah, because I don't have the underlying statute to reference here on the screen. The sections 32 and 33 take effect next spring. Why the delay there? You probably already said it, and
I didn't. These were
monkeying with
parts
the
of
computer.
Act 91 that actually didn't relate to healthcare. So these are pieces of Act 91 that I'm just looking at what they were, but I think these were some of the either labor law or transportation law parts of Act 91. So the health, so let's see, you said sections 32 and 33. I'm scrolling through Act 91. So we're not making any changes to those.
There.
Right. They're just in there because they're existing law. So this is, they are some repeals. So they are repeals of COVID-19 related unemployment insurance provisions.
Okay.
So I think they made some changes to the unemployment insurance laws relating to COVID and then put a future prospective repeal date or sunset those.
Thank you.
But these all, these are not These are not healthcare related.
That's all.
Representative Page and then Representative Rogers, you guys.
Yes, my question is, why do we have to have legislation for DFR to establish a working group to look into this issue? I'm just curious. I mean, why can't they just do it on their own? Or wouldn't,
They could.
or shouldn't they know enough that they need to do something so that they would establish a working group or look into the issue without us establishing legislation for them to do this?
I think they actually have established a working group, or it sounds like they are having they are having ongoing conversations with a lot of the interested stakeholders on this issue. It's a policy choice whether you want to do something through legislation or not. When you design a working group through legislation, you're able to direct some of the parameters and the participants and to ask for a deliverable by a date certain. But you're right that they could have the conversations. They could even come to the legislature with a recommendation without legislation.
Okay.
Okay, thank you.
So that'll be something to discuss. Representative Rogers.
Thank you. I definitely understand. I think I understand where Representative Page is coming from with this. I guess I would just add, if we are taking the time to decide to do it through legislation, I think it could be a good opportunity to ensure that the members of the working group were geographically diverse, which is throughout the state, which I think is particularly important with telehealth work and telephone work and the differences in internet access throughout the state. My question was just, Jen, I was wondering if you could clarify the legality of passing legislation that changes legislation we already passed in the same biennium. I'm not sure I'm 100% clear about that, but it seems like this would pretty clearly change something that had already passed through both bodies.
Yeah, it would change something that had passed through both bodies. As I understand it, there's no prohibition on making changes to something you've passed. The only issue is a substantial negation of something that would undo something that had been passed during the same biennium.
Thank you.
Okay. Any other questions? All right. Thank you. So why don't we hear from, and let me say right up front, for Catherine Fulton, Helen Laban, and Jill Mazza Olson, we welcome your comments on this bill. And then I'm hoping that you can stay for the next discussion on the next proposal as well. And then we have Joshua Green, Dr. Green here. He'll be coming in to talk about the next proposal. Catherine Fulton, welcome back.
Thank you, Senator Lyons, and good morning, everyone. Very happy to join you for the duration this morning. And also, I think this is a great opportunity. Nellie, I'm not sure if you could bring up our member list of the statewide telehealth workgroup membership, listing everyone that you mentioned, that is, the constituencies and stakeholders mentioned in the bill, and then some. I think, and I'm really shooting from the hip here, I think there could be an opportunity to embrace what you would like to see DFR accomplish within the work group activities. As it so happens, we have a work group for some of the executive leadership scheduled for tomorrow afternoon. Unfortunately, it wasn't able to be scheduled and accomplished prior to this follow-up. But if, Nellie, if you just kind of scroll through the list, and it's, I think we have 47 members, and this is very much a snapshot in time. And of course, it's not a closed list. We are welcome to include others. I do not believe at the moment DFR is included in the current list. because we started out from the perspective of, a provider-led and very patient-centered activity, supporting our providers with, I think as I mentioned on Tuesday, we were off to the races in the month of March and took the work plan for what we had intended to be a very mindful and thoughtful approach to increasing the utilization and adoption of telehealth services. And we've really just picked up the pace and we're off to the races. But with that perspective kind of still happening currently, that we're providing coding and reimbursement and how-to sessions to encourage providers' uptake and increasing their comfort levels. But if you see the whole range of participants here in the group, I think we'd have all the right people at the table, the voices to follow up on what you're suggesting in the bill. So I'd just like to make that offer. And maybe at the very least, we would, kind of run in tandem and collaborate very, very closely. So maybe I'll just kind of pause there to share thoughts.
We lost Ginny.
I was just going to say, I don't
Looks like
see
we did.
Senator
I
Lyons.
think Senator Lyons is no longer on the screen. Maybe we can check to see if what's happening there.
Dexter.
So also Helen and Jill, Helen LeBun and Jill Olson are also included in the membership list. Maybe I would, I don't want to step on.
I'm going to suggest that we pause until Senator Lyons can rejoin us. And rather than move ahead and have to have her wonder what we've done in the interim. So let me just check and make sure that either Nellie, are you in touch with Senator Lyons?
I haven't heard anything from her. I'm resending the Zoom information to her just in case she's missing it.
Yeah, perhaps someone could try to reach her by cell to just determine.
Yeah, I'll do that, Representative Lippert.
Thank you.
But she's not replying, so I'll call her.
Yeah, I think it's useful. I found it useful rather than to just, if there's connectivity problems through the internet. And if for some reason she's not able to join us, we can continue.
This is Lori. I got kicked off. Are we still moving along here?
Okay, that might have been what happened. We're trying to find out what happened to Senator Lyons as well. You got somehow dropped.
Yeah, I'm saying I have no internet, so now I'm on my phone, but I got dropped. Yes.
Okay, that may have been what happened to Senator Lyons as well. We're at this point, we're just waiting to see if we can reestablish connection to Senator Lyons.
Okay.
Senator Ingram, were you able to reach Senator Lyons?
I was, and she's trying very assiduously to get back on with us. She got off completely, and now she's trying to use Nellie's new email and try again.
Okay, great. Thank you for.
She told us we should just go ahead. She said we should go ahead.
Okay.
If you want to take more testimony.
Let's give it a minute. And if she's not with us in a minute, then we'll just continue.
Okay.
And it is my understanding that we're continuing to be broadcast on YouTube by audio. So everyone should just be aware that that's happening. Why don't we continue? Nellie or whoever's responsible. Yes, thank you for taking that down. So it seems that Senator Ingram's been able to be in touch with Senator Lyons, who's working to rejoin us, and suggest that we continue. So let's continue on. I think we were hearing from I have to get my list in front of me here. We're from Catherine Fulton. And Catherine, why don't you continue to, I think what I'm going to suggest is that you complete your testimony, and then let's reserve committee discussion for after we've heard from other witnesses as well.
Certainly. Thank you, Representative Lippert. So the early progress of the statewide telehealth work group meeting so far has, as we said, we've brought the group up to what I would call the foundations of the learning curve. So we've incorporated a great deal of information on barriers to broadband access. The group received an early presentation from the Department of Public Safety. And then with the acceleration of the learning curve of just the telehealth technology itself, we focused many of the office hour sessions and yet another session this morning at 8 o'clock on the complexity and nuance of the different payer requirements, the billing and coding. I mean, mind-bending detail of reimbursement coding that Helen LeBun has really become my local expert, and we've been able through her to connect to a regional expert that lives, sleeps, and breathes the intricacies of Medicare and FQHC billing.
So can I interrupt? Let me, without being rude, let me interrupt. I'd like to actually focus the testimony on the material that is in front of us and save the other testimony for later this morning, which is what I think Senator Lyons is intended. So rather than getting into the range of broadband issues, et cetera, at this time, I'd particularly, if there's any specific comments on the proposals that Jennifer Carby has put in front of us, that I think that's what we'd like to hear at this point. So we understand your offer of using the group to perhaps address what's in this suggested to be done through DFR. Are there any other specific comments in terms of the proposals that Jennifer Carby reviewed?
No, just that we would be very willing and able to pick up that cause and fold it into the forming documents of the continuing work of the statewide telehealth work group. And as stated earlier, at the very least, run in tandem or deep collaboration.
Great, thank you. We appreciate that offer, and we'll take that up as part of our committee discussion then. I have to say that, let me see. So then I think we also were looking to hear from Helen. Are you?
I am here, thank you.
Okay, again, let's focus our attention on the specifics of the proposal that Jen Carby walked through us, and then I think Senator Lyons would like to talk more broadly around broadband issues later in the morning.
Definitely. So I'm Helen Laban. I'm the Vermont Public Policy Director for Bi-State Primary Care Association. Jill Olson, I believe, is not joining us right now, although she was mentioned before. I did speak to her, so I'll speak for both of us. We'll be efficient that way. So just 3 quick points to this particular proposal. One is that, as noted before, a group of us have been working with DFR, including providers, payers, the healthcare advocate, and it's been working really well. It's been a great process. It's been wonderful through the rapid emergency rulemaking. So double thumbs up for that particular group.
I think they've done a good job with that. Yeah.
I will say 2 quick things on this proposal, and Jill, I believe, mentioned in her previous testimony that she would be submitting a letter to this effect from the different provider groups, and that's around audio only telephone. We would like to have it ensure that it will remain available at least through the end of fiscal year
Excuse me,
2021.
Helen.
Yes.
I'm sorry. I'm sorry. Senator Lyons is on by phone now. She's having trouble with her internet, but Nellie, could you make sure she's unmuted?
She should be unmuted. It looks like she is.
Okay.
Am I I'm here. Am I unmuted?
Yes, you are.
We hear you, Senator Lyons.
Good, thank you. It's fairly frustrating to be not seeing you all, but I'm sorry to interrupt. Go ahead.
No, well, we were continuing with the testimony. We just finished hearing from Catherine Fulton. I've asked people to focus on the proposals from Jennifer Karby and save broader comments about broadband for later in the morning, which I think is what your intention was. So Helen was in the midst of telling us about a specific proposal, I think, in terms of telephone. So why don't you continue?
Correct, and thank you. The proposal was to extend audio-only telephone through the end of fiscal year 2021. This is in case the emergency orders are lifted, but we still have the waves of COVID-19 response going through. It's hard to stand up systems and take them down, then stand them up and take them down. So we would like some assurance that will continue to be available. And the second comment was also a timing comment on the deadline for this working group. At this time, December 1st seems like a century from now at the pace things are going. It would be, I would advocate for moving it up to September 1st as an earlier deadline. Even if we still have audio only telephone available, say through the end of fiscal year 2021, as is being proposed, moving up the deadline for knowing what the structure is going to be exiting the COVID-19 emergency will just give us that much more runway to build it up correctly. As I testified to previously, we did a 48-hour turnaround to being all remote services, and now we're entering the very real work of building this into a sustainable system that can continue to deliver healthcare effectively moving forward into the future, well beyond the end of COVID-19. So the sooner that we have certainty on what the world's going to look like and what the landscape will look like, the better we'll be able to support our practices in doing that. So I would advocate for moving up that deadline to September 1st.
Okay.
Thank you.
Any other comments, Helen, before we?
That is the end of my comments. Thank you for the opportunity to comment.
Thank you. Just one. Okay, I'm getting a communication that just for people's information that you may get dropped. Lori's been dropped and can now connect not even by phone. That's Representative Houghton. So we seem to be having some of our own connectivity issues here this morning. Yes, Catherine Fulton, you have a comment, further comment? You're muted, or you're not coming
There
through.
we go. Apologies. Can you hear me?
Yes.
Yes. So sorry. One thought I neglected. I think it just left my head in the pause earlier. Also supporting Helen as we start to work with our statewide work group, looking at the lessons learned and the experience gained through the crisis and the opportunity to evaluate both what is valuable and meaningful that we've learned, and then kind of find out what needs to be abandoned as we cross over to the other side, and focusing some of our work on establishing best a best practice and lessons learned, not just from within Vermont, but across regional and national resources as that information becomes available. So my apologies for neglecting to include that.
Surely. Okay. I think having heard from Catherine Fulton, Helen Laban, Senator Lyons, I'm looking at the agenda for this morning and I see that, well, first to tell you that we understand that Jill Olson is not available and Helen has included some of her comments. I might actually, there was a suggestion that there's going to be a letter. I don't believe we received that letter to this point. Is that correct, Helen? There was going to be a joint letter sent to our committees.
So of the things I confirmed with Jill before joining you, I have to admit that was not one that I confirmed.
Okay,
So-
perhaps you could communicate with her. I think
I
that
will
was
communicate
referenced.
with her on that one. I apologize for that.
Okay, I believe there was a suggestion that, as you referenced, a letter would be forthcoming.
But what you heard, I essentially said verbatim
Yeah.
all that it has to say on the topic of
Right,
audio
right.
only, which is that we would like it to become a permanent option
I
and
understand.
also to extend. So
It'd
that's
be,
what-
if there's a letter, that'd be helpful. So let me then check in with Senator Lyons. On our agenda is Joshua Green from the Vermont Association of Naturopathic Physicians, and I'm not clear, Senator Lyons, whether that was to be part of this morning's early testimony or something later. Can you clarify that?
Yes, thanks, Bill. It's actually for the next
That's what
topic.
I was thinking that might
And-
be, yeah.
And just to let you know, I did get a text message that Jill Olson will be available at 11 o'clock today. But it sounds like, Catherine, you provided the testimony that she was, or at least some of her comments, so that's helpful.
I think Helen covered it for her, yeah.
Oh, Helen did. I'm sorry. Okay, good.
Mhm.
So I think, at this point, we have a little bit of time. It might be helpful, and you can see people raising their hands, and Lori Houghton and I can interject when we want to ask a question or make a comment. So, Bill, why don't we just have a conversation with committee members, giving
Sure.
their thoughts on this whole
That
issue.
sounds fine. And we have several people. Lori, your hand is up. Is that, you're back. Welcome back, both audio
you.
and video. Representative Houghton, why don't you, followed by Senator Westman, I think has a comment as well.
Okay, and if I get cut off again, just go on without me. Obviously, we can answer this later. And I can't pull up the document with the language Jen ran over, but this is a question for Jen. And I apologize, I can't pull it up. It could answer my question. But is Medicaid covered in the store and forward moving to May 1st? Or how are they reflected in this language?
That's a good question. I have to look at the underlying legislation and remember how we define health insurance in that statute. So give me a minute to pull up. So yes, in the way we define health insurance plan, that's the piece I needed, in 8 VSA 4100K, that includes Medicaid. So that would then move their date as well up to May 1st for store and forward.
Okay,
It's a good point, maybe something you want to check with them about.
with Diva on. Yep.
Because they were not, just to play that out a little bit, they were not included in the DFR emergency rule because they are not subject to DFR jurisdiction. So the move to May 1st for store and forward may be a change for them from their current practice. I don't know.
Right, and I don't remember if we heard from them. I apologize as to whether or not they were doing store and forward. I don't think we did. So it might be something Senator and Representative Lippard we want to check on with them.
So I think they are doing store and forward, but we probably should get their comments on this, on the dates and what we're doing.
Yeah, I suspect someone from DIVA may be watching, but if not, I will reach out to them and we can get some clarity around that.
Okay. Anything else, Lori?
No, thank you.
Okay, Senator Westman, followed by Representative Chena.
I had a question about the membership list on the state-wide telehealth group. They've laid out all the organizations and they've laid out the titles of everyone. What it's really impossible for me to tell is how many people on that group are on the ground practitioners that are dealing with the day-to-day of doing this work. And one comment from that, almost every visit that is a complicated visit in my county, the home health agency has somebody there with the person when they're calling in to do that work. And I have whole sections of my county without any internet service and very difficult to connect. So I think the on the ground people are important, and I don't see that in here.
Okay, I don't have that list right in front of me, but let's keep that comment in mind as we think about how to move forward. Okay. Representative Chena, followed by Representative Rogers. I'm Senator Westman. I'm just going to suggest that rather than try to resolve comments at this point, that we hear the comments and then we continue.
Well, that wasn't just a comment. I have trouble understanding from the list and the titles who's on the ground doing that. So they would need to feed back in that. So that's my question. And my comment was that I need to know that to understand how effective this group is going to be.
Right. Thank you.
Yeah, can I make a comment
Please,
on that?
Senator Lyons, please.
I just, I think it's a really good point, and perhaps there's some direction we can give. It's hard to identify individuals within something like this, but organizations and stakeholders, people who have an interest, we can do that. So it might be a point of direction to just say that the membership or those included in the discussion shall include some who are boots on the ground. I'm just thinking it off the top of my head.
Yeah, but that seems like, I think, Senator Westman, your point is well taken. And I think we really need to hear from those who are actually dealing with this from a practical day-to-day point of view, including home health, which plays a very important role. But then, so let's continue. Let's include that.
Can you put me in the queue, Bill?
Yes, I didn't see your. Yes, you're consider yourself.
I don't have a hand.
Yeah, got it. Okay. Well, why don't you go ahead and make a comment further comment if you wish right now, and then we'll hear from Representative Chena and Representative Rogers.
Okay, I just received a letter that went to Jen Carby and copied me and you from Nissa James at DIVA. And it says, shall I read it?
Please.
For you? Okay. And then we can have Nissa clarify. She must be listening in to the meeting, and it would be great to have her with us. So Act 91 of 2020 required health insurers and Medicaid to implement store and forward broadly beyond the existing state statute for January 2021. I'm writing to confirm if the intent of the new draft legislation that was just presented is to also apply to Medicaid for the amended retroactive date as it appears from quick review that the language is written may apply to Medicaid given the existing language within Act 91. Vermont Medicaid has begun the process of working with the Clinical Utilization Review Board to implement the requirements for 1/1/21 outside the coverage on their code G 2010.
Any requirements for Medicaid related to telephonic coverage with regard to the working group should also include the standard language regarding as permissible by federal regulation guidance, as CMS has been very clear to date that our expansion of coverage flexibilities are tied to the public health emergency. So that we can bring Nissa in and clarify her memo, but I just wanted you to know we did have something.
Okay, yeah, it's a little hard to follow.
I know it was, so, but
but
at least there's something there.
Yeah, great. Thank you. Anything further, Senator Lyons, before we move to Representative Gina? Nope. Okay.
Nope.
Okay, Representative Gina, followed by Representative Rogers.
So some of what I say is going to kind of build on what Senator Westman brought up. That I'm concerned about, like during the emergency, we increased access to services for a lot of people by allowing telephone, certain procedures and services to be provided over telephone. But we don't have the infrastructure in place to support telemedicine the way that we had originally envisioned. And so my concern is that if we go out of a state of emergency and we haven't settled this quick enough, that there's going to be people left without services that they become accustomed to and need. And so I support Helen's suggestion that we have an earlier report back date of September 1st. I think that that's important. There is fascinating. I guess that Zoom thought that that was important too. And then another concern I have is around, so there's that issue of access, which Senator Westman was talking about, and how it ties into the time, and that there's, how do I say this? Like, there's been some issues. I'm crossing the boundary into being a provider, but there's been some issues with billing for telemedicine. There's inconsistency between different insurance carriers and how that you bill for the same exact service and what they cover, and it's getting worked out, but it's been messy. And so I don't know if there's a piece of that I don't know if we need to put it in the language, or if me saying it here is enough for people who are going to be on that group to hear it. But it would be nice to if that group could work out some of those kinks so that it's easier for providers to focus on care versus behind the scenes complications. And then just the piece around independent about actual boots on the ground or direct service people. Like, I was going to suggest that we maybe reach out to some groups and see if they're interested. I think it's nice that we say other interested providers, but a lot of providers are doing the work and not tracking what we do here. And I've been in multiple telemedicine trainings over the last few weeks with different people. And a lot of providers really are looking for guidance and looking to be engaged, but they're not going to know where to look if people don't reach out and specifically ask them. So I was thinking maybe, like, as a social worker, I look to the National Association of Social Workers for guidance. Maybe we should reach out to them and see if there's a place for them in this, or like I don't know what it's called in Vermont, like the American Psychologists. I think like Rick Barnett's part of that. That there's professional organizations in Vermont that we might reach out to, and even if we don't include them in the language, I think that it should just be said that some outreach to those groups might increase involvement of people who are doing the direct work. So that's just what I wanted to add. So it may not be a question as much as concerns and questions for that group to take on. And I don't know if any of that needs to be in the language.
Right. Okay. Well, let's keep your comments in mind as we decide how to move forward. Thank you. Representative Rogers.
Thank you. Just to build on the prior few comments, I guess my comment or concern is going back to the piece of geographic diversity. And I think Representative Gina makes a great point that there might be interested providers who aren't aware of this group or aren't being reached out to. And I appreciate the group's emphasis on inclusion of anyone who would like to be included. My experience in an area that has limited internet access in the state is that the providers in my area might not even consider themselves interested providers, because I think the enthusiasm for telehealth and telemedicine and working on those issues decreases directly as internet access gets worse and worse. And so my concern is that through this intentional inclusion of all interested parties, we're ending up with inclusion of people in areas of the state where there is good internet access, because if there isn't good internet access, the providers have no interest or ability to want to come to the table about telehealth. And so I did look through the provider representation on the list, which I appreciated that was sent out to us. And there were a few statewide members. And then of the specific providers, the vast majority were from Burlington, well over half, probably over 3/4. And then the only other two places represented in any way were Rutland and Brattleboro. And so I guess I would bring that to the table as a concern, and also as a point of further discussion, to be that interested providers might be actually leaving out a large portion of the state. Like, you have to have internet first to be interested, or you have to be specifically asked to come to the table.
Okay. Senator Lyons.
Uh,
Wait a minute, wait a minute. Jen Carby, I think has,
Go to Jen first.
yeah, go to
I
Jen
just,
first.
I think we need to be careful when talking about whether we're talking about the list of people in the telehealth working group that VPQHC has, which is not a statutory or legislatively created group, and the language that we were looking at that is specific to figuring out the future of coverage for services delivered by telephone. And that's where it talks about interested stakeholders. So when you're thinking about who you want to include where, the only place we're looking at creating something at the moment, you can create another working group if you want, but is really around talking about coverage for telephone.
Great. So yeah, to clarify, my concerns were directed at the list of the VPQHC members, and my comments would apply to any consideration of, if we do create a statutorily created group, my comments would apply to any consideration of who would be included in that group.
Okay, thank you. Senator Lyons.
Yeah, so I was going to say that when I look at the group that is listed as VPQHC, and I'll look at it again, I do see organizations that are statewide. So Vermont Medical Society, the VNA. If the concern, and I see, mental health folks, at least the Rutland Mental Health Group. I see the Howard Center, which does have a presence broader than Chittenden County. You have to remember that the services go extensively across the state, and which is more in the welfare side of things sometimes, but the mental health side is there too. So there is an overlap. So maybe a consideration about Vermont Care Partners or something like that, if they are currently utilizing telephone connections. So absolutely, we want to be certain that the people we're reaching, as both you and Representative Chena have said, are statewide. And I think Catherine was going to make a comment about that.
Well, let me also say, I think one of the points that I think was being made by, I believe, Senator Westman and Representative Rogers in particular, were that if you don't have internet access to start with, your participation in such a group like this is less likely to happen in the first place, because in fact, and to try to resolve an issue about lack of connectivity by only talking with those who already have connectivity is a bit of a strange structure. So I'm taking from those comments, and I think personally, I think they're well taken, that we need to find a way to engage with those parts of the state where in fact internet access does not currently really exist in a substantial way, and where access to health through telephone would be particularly important. So I just think we need to be aware of that and think about it as we ask for proposals of how to extend this beyond the emergency period.
So I know that Representative Page has his hand up, but I wanted to say
I see, yeah.
It's an excellent segue into our next topic. So you have described a little bit of what we want to accomplish as we move to our next topic at 11 o'clock. So
Okay, well, let's hear from Representative Page, and then see if we can't think about how to move forward on the proposals in front of us. And my suggestion, well, I'll have a suggestion in a minute, but Representative Page?
Yes, Representative Lippert. I have a concern regarding services via telephone. I've been reading where, the Public Service Commission is moving kind of away from landlines and less emphasis on support of the telephone system using landlines. So we're getting away from that. And then we're moving towards cell phones, and we have issues, where the service is poor versus for those cell phone services in remote areas. So I'm wondering whether we should discuss that a little bit with the with this bill. We mentioned telephone service, but should we expand it to cell phone service as well? Just throwing that idea out there. See what everyone thinks.
Okay, I see Senator Cummings signaling that she'd like to speak.
Okay. I don't know that the Public Service Commission is moving away from landlines, as that people are moving away from landlines and moving to cell phones. Landlines are still the source of last resort. Most people have access to them, and they are the ones that are required to provide emergency access. Cell phones, like internet, because of our topography and our rural nature, are more problematic because they're more expensive. But the population people are definitely moving to cell phones.
I don't know whether it's something that we need to address in our bill, but I'm just throwing it out there. So.
Okay. So can I just summarize what I think? It seems most of the questions with regard to the proposal that Jen Carby walked us through this morning have to do with the nature of the group looking at continuation of telephone, and not so much really about the closing the gap. I think is it fair to say that there's pretty much unanimity that first portion is crafted in a way that has broad support, and I'm seeing. I think that's my sense, and that the comments really are about
we can all put up our little blue hands.
Well, maybe, yeah.
Yes, we have
Can you
consensus.
rephrase? I was trying to give Jill Olson the Zoom number while you were speaking, and my brain just turned off.
Okay, so here's basically I'm dividing. So basically, I'm dividing the question and saying that I think how many. So those of you, let's use the blue hands if that works. Just indicate support for the first portion. This is like a straw poll. We're not voting. This is a straw poll. For the first portion, which is the closing of the gap between store and forward. I think that's pretty, my sense is, I see a lot of blue hands going up.
I can't get my hand up. I'm raising it.
I can't raise my hand because it's already raised for support. I was just wondering if maybe for the help of the YouTube viewers, we could raise our actual hands. Like, I just know for people viewing, it's kind of hard if you can't see what's going on.
So I know you want to do a straw poll on this, so I think that's really a good idea. So let's put our hands up if you agree with Bill's proposal.
I'm talking about the first section has to do with store and forward. Okay. Okay. I see. Everyone I see has their hand up. That's it. Senator Westman, I thought your hand went up. Am I correct? Yes. Okay. So thank you. So let's all take our hands down now just for the hell. Excuse me.
And it does seem like you might need a little bit more clarity from DEVA around their ability to meet that date, and whether there needs to be a separate, whether that should just be insurance, health insurance, rather than health insurance and Medicaid.
Okay, I'm not sure I follow that, Jen, but let's sort that off. sort that out further. I think,
No, no, that's related to Nissa's
Right.
message.
but we
And-
haven't, to be honest, I
Well,
haven't had a chance to look at the letter.
No,
and-
no, I think we need to hear from Medicaid. I think that's
Yeah.
really important. I
Right.
think that's all.
Right, but apart from, yeah, okay. And then as to the second, we had suggestions that are from like, do we need to put anything in statute? I think Representative Page raises a good question. Do we need something in statute? Can we just have someone do that? We've had Catherine Fulton offer her group to step in instead or to do parallel work, and we have the proposal in front of us. And concerns about the nature of the representation on the group, geographic diversity, actual on the ground providers, et cetera. My experience is that it's less likely that we would resolve something like this by trying to have all of us craft something together right now. I would suggest perhaps that Senator Lyons, maybe a few people volunteer to help revisit the language of the proposal in front of us and bring something back.
So I would think that would be good. We've heard a lot of comments about the
Yeah, I think
proposal.
useful comments.
I would say that what we have heard from folks is that the telephone has become critically important
Yes,
in healthcare, and that it has underscored some deficiencies in the system, but also offered some strength for patient-provider contact. What we also have heard is that going forward, if the telephone is not allowed, it's going to reduce patient contact. But then if it is allowed, there's still a lot of things to sort out, you know, HIPAA compliance being one, and then sort of the issue around who gets paid for how much for what kind of
Right.
telephone call. So we haven't talked about any of that, but that's what's embedded in this discussion.
exactly.
So I think the folks who are listed on the VPQHC, the whole group with Helen and Catherine and Jill and so on, it's a pretty broad group. And I think they have been trying to sort out who's using what kind of audio or audio visual, and then where are the glitches? You know, how are they going to get paid going forward? I think that is also a huge issue as we look at access. So it's both access and cost. So anyway, it is changing the landscape for healthcare, and I don't think we can ignore it. As you can tell, I value having this in legislation because it gives us a definitive proposal that the legislature can then debate, should we need to do that. It puts the DFR and DIVA in a place where they can discuss all the issues that are embedded when we talk about continuing telephone. So
Okay.
those are my comments.
Okay, one quick comment and then hear from Senator Cummings and Senator McCormick. We haven't actually heard from DFR, which we're asking them to actually take charge of this, I believe. So I think that's one piece we would need to do as well. Senator Cummings? Senator Cummings, I think you're muted.
Sorry. Senator Lyons touched on my issue, which is all of these things are good, but there's also the cost and the overall cost of health insurance when we come out of this. And that's another issue that just needs to be balanced. And I know telephone right now is being reimbursed the same as an office visit, I believe, and I'm not sure in all cases that's sustainable. I mean, I'd love to be able to call up and say, my kid's got another earache this month. Can you send me out some amoxicillin? But that's not quite the same as a 40-minute mental health discussion. And at some point, we're going to have to divide those out. So just my comment.
Okay.
So it sounds like we would like to hear from both DFR and DIVA. and get their input on this one. And I think it's after that, then we can modify the proposal any way we want.
Okay, and I think one of the other places where I don't know if consensus, but I think there was a fair amount of interest in accelerating the decision-making and not waiting till December 1st. There seemed to be, so let's make sure that that's in the mix as well. So I'm going to suggest, Senator Lyons, that you continue to craft a proposal with the comments that have been taken here today, and that we put this on the agenda again for that portion at a future joint meeting.
Whenever I think we have that down next Thursday, we have a joint meeting.
Okay.
And I think we do have this bill scheduled.
Okay. So
Okay.
Does that seem like a plan? But I think we've heard some important comments here today in terms of trying to integrate and either
Yeah,
give
absolutely.
guidance or direction to who's part of the group.
So listen, anyone, committee members, please send me your comments. And if you want to talk by phone, we can do that.
So with that, Senator Lyons, I'm going to suggest that I cede the chairing of this Zoom back to you, since I think to be honest, initially the House Healthcare Committee had been planning to join for this first hour. And although the issues continue, the related issues, but let me turn this back over to you, since I think you and your committee had taken the initiative around broadband issues more broadly, so to speak. Is that agreeable?
That sounds very
I turn
good.
this back to you.
Yes, thank you.
And I would say for the House Healthcare Committee members that let's continue. I think we're welcome to continue to be here and participate as appropriate, but understand that the Senate Health and Welfare Committee has taken some initiative on this. And if for those who had planned to need to leave, we'll gracefully exit the Zoom call.
You may want to stick around.
No, I understand. I think
After listening to the conversation that we've just had, I think this really targets some of the
Yeah.
issues that we're hearing about.
But I do
So-
understand there are some members of our committee who are not going to be able to stay, and just so for people to understand that had been the intention.
Not a problem, not a problem at all, but you're very welcome and look forward to that. So let me just talk briefly about what we'll be looking at. We have both Maria Royal and Jen Carby with us this morning. When the Senate Health and Welfare started to take testimony about the tranches of money available to the state from the federal government, we did hear about monies that were available to providers, and that providers could access both devices, hardware, software, for patients who didn't have access to those things to support telehealth. We also then found out from our Ledge Counsel, Maria Royal, and she's going to go through this a little bit with us, that there are other monies available, and some of the money that's available to providers actually allow for connectivity overall. So not the millions of dollars that Senator Cummings is going to be looking for to complete the statewide plan, but bits and pieces here and there where patients are not connected, and in particular during the emergency, where vulnerable patients might very much benefit from being connected and having telemedicine, telehealth, and in fact, telephone services. So it very much links in with the conversation that we've just had. And what I suggested, it occurred to me while we were listening to the availability of funds, that providers on the ground, those people who are actually doing the work, they're in contact with patients who need support. And those providers may or may not know about how to access the federal funds. So what I think we might be interested in is how to coordinate the access of funds for those providers, because it is provider-driven. It's a provider-driven process. How to access those funds, and allow for providers to purchase, work with patients to purchase devices that will help them access healthcare. And if some of those funds allow for inexpensive connectivity, all to the benefit both of the patient, the provider, and ultimately the state. So that's kind of the thought behind the proposal. And what I will do is I'm going to turn it over to Maria and Jen. And I think, Maria, maybe we can go through some of the monies that are available pretty briefly. And then Jen, the proposal that we have. And I did not want to neglect Dr. Green, who's been with us. And actually, we will turn to you, Dr. Green. Let's go to you after. I hope you have time. I'm looking for you on my screen. Joshua Green, is he still here? If you're here, speak up.
Dr. Green sent me an email saying he had to leave to go see a patient for 11, but he'll be back on at 11:30.
Oh, that's good timing. Okay, perfect. Thank you. So we'll go right to Maria, and why don't we go through some of the federal dollars that are available for the things we've been talking about.
Great, happy to do that. Can you all hear me?
Yes.
Terrific. So Maria Royal with Legislative Counsel. And I just want to tell you a little bit about the document that I've just shared with you that's posted also on your webpage. So this is a summary of various connectivity funding streams, primarily in the CARES Act, but also some additional programs that are available to invest in broadband deployment, some pretty significant programs. It's divided into categories. The first category, as you can see on the screen, rural and economic development. The next category, which we're going to be going through, concerns telehealth. And then the next category is education, and then finally digital inclusion. So when I approach this, I'm looking generally at connectivity issues, and to the extent there's money for network infrastructure, network equipment, end user devices, or money to offset or subsidize the costs of subscriptions. So that's how I'm approaching it. And so what this document does is identify all of the various funding streams, and to the extent some of that money might be available for the actual connections to the internet. So that's just a description of the document that you have, but then I'm going to scroll down and we'll walk through, if this makes sense, the specific telehealth funding streams. Let's see. I'm just gonna bear with me for 1 minute. I'm gonna try to figure out the best way of presenting this. Okay, so now that I've said that, there are gonna be exceptions, as is always the case. Most of these programs that I'm identifying received appropriations under the CARES Act. There is at least one program that did not receive an appropriation, but is a new FCC program that will be relevant to any healthcare providers that are seeking funding for telehealth initiatives. So I just wanted to clarify that. But the first one that we'll talk about, and we'll just go through these programs to identify some key things like what they can be used for in terms of connectivity, funding, and also what some of the application deadlines are, because some of the programs are up and running now and accepting applications now, and they have limited funds, and those funds are only available until they are expended. So in an attempt to try to kind of coordinate efforts and the availability of funding, I just wanted to highlight some of those key program characteristics. So I think there are about 5 or 6 telehealth related programs, and we'll just go through them now. The first one is an FCC program. This is a brand new program, the COVID-19 telehealth program. It received $200 million under the CARES Act. And this is one of the programs that is open now. They are accepting applications. And again, those funds are only available, or the program is only open until the funds are expended. So in terms of who can apply for these funds, you'll see there is a list of eligible healthcare providers. It includes post-secondary educational institutions, hospitals, medical schools, community health centers, local health departments or agencies, community mental health centers, nonprofit hospitals, rural clinics, skilled nursing facilities, and any consortia of healthcare providers. So these are the entities that can seek funding through this program. There are links to the FCC report and order, which describes the program in greater detail, as well as the guidance that was issued by the FCC. But looking at connectivity more generally and how some of these funds can go towards services and devices, the guidance and the program rules specify that it can be used for telecommunications. And in this context, that means voice services, as well as broadband connectivity services. And then more broadly, kind of beyond the scope of what I'm looking at, the various healthcare software and hardware technology that might be used in delivering healthcare via telehealth. And then also, there is money for the actual end user equipment, such as tablets and smartphones, just to give you some idea. And then significantly, providers would be able, if, for example, they wanted some of the funding to go towards subscriptions to broadband services, they could potentially receive reimbursement for any services that were incurred as of March 13th, and then going forward until September 30th of this year. So those recurring charges for broadband connectivity. So that's just to make it clear to any providers. What I wanted to just mention, as I said earlier, this program is up and running now. Applications are being accepted on a rolling basis. To date, about 30 healthcare providers have received grants under the program in 16 states, totaling about $13.7 million so far. And there is an unofficial cap of about $1 million per grantee, although healthcare providers can reapply. And so far, just looking at some of the awards that have been made, they've been as low as $46,000. Interestingly, you can go online and look at the filed applications on the FCC's electronic comment filing system. And I think that's really helpful if you are applying for a grant to see what what providers are looking for. And it ranges, what I've seen so far, as low as $5,000, a grant awarded very small amounts for very specific purposes, all the way up into the unofficial $1 million cap. And that cap is basically, the FCC said, it will consider going over $1 million, but the idea is to limit the amount per provider so that it can be spread across the greatest number of providers nationwide. But please stop me at any point if you have any questions.
So Maria, I think it's probably a good idea to summarize as much as possible. I know there's a great deal of information in the whole thing.
Okay.
So yeah, because I think the important thing for us is to figure out how to coordinate the use of the funds as much as
Great.
what's here.
Great. Okay. Thank you. So I'm going to step it back. You have all of this detailed information to the extent it's helpful and you want to look at. I'm going to bring it to a higher level. Just letting you know, there is a connected care pilot program through the FCC. This is a long-range 3-year pilot program available to healthcare providers to look at opportunities for providing telehealth services. So, and just again, highlighting some of the application deadlines. This will be receiving applications until July 31st, potentially later than that, but this is again to give you an idea. There are some other funding streams. For example, the one now at the top of the page, this is a large appropriation. I'm not going to go into it in detail, $27 billion to the U.S. Department of Health and Human Services, the specific Public Health and Social Services Emergency Fund. You can see I italicized and underlined language on the right that some of this money can be used for telehealth service and infrastructure. This money can also be used for vaccine development and research and manufacturing. So exactly how it's going to trickle down to telehealth and infrastructure remains to be determined, but I did want to include it here. Similarly, there is money that also runs through the Department of Health and Human Services, but specifically through HRSA, the Health Resources and Services Administration. And there are a number of programs, and they're all included here. Another potential funding streams, grant programs, too numerous to list. And they all have their own specific requirements about what the funding can be used for. So in some instances, grants cannot be used for construction costs or installation of transmission equipment. And that's just to, clarify again that it's going to vary depending on the program, what the money can be used for. And then just to let you know, there's some money that was appropriated to the Department of Veterans Affairs for their IT systems, but also you can see the Secretary of the VA can enter into agreements with telecommunications providers or communications providers to provide complimentary or subsidized broadband connectivity for veterans. So that's just to let you know that that opportunity is out there. And then the last program you'll be happy to know that I'm going to talk about is an existing program that's run through the Department of Agriculture. This is the Distance Learning and Telemedicine, otherwise known as the DLT program, which received an additional $25 million. And that money, the application deadline to receive that money is July 13th. And what I wanted to highlight is, you can see at the bottom of the screen on the right, this is an example of grant funds that may be used for broadband transmission facilities. So you can see a lot of variability in terms of specifically what kind of connectivity may be funded with through these programs. And then also some of them, it's just not clear yet, and they are in the process of development. The last thing I'm going to highlight on this document is this will help put things in context with respect to broadband funding programs generally, not specific to telehealth. The NTIA, sorry, let me just try to remember where I actually included it. Oh, okay. So you'll see at the top of the screen here, there is a database that the NTIA has put together. There are over 57 federal broadband programs that exist today, not related to CARES Act, obviously. So this is just to highlight that there are many opportunities and potential funding sources out there. So I hope that's helpful. That's a lot of information, but that just gives you an idea of kind of what the various funding streams potentially are related to connectivity.
Okay.
Are there questions for me?
Questions? Questions for Maria? Oh, good. Now I can see everybody. Any questions? So if I were a provider, regardless of the type, and I knew there was money out there, I wouldn't know where to begin in trying to sort out all that information. So what you've done is extremely helpful. I will say that while we were preparing to have a discussion about the issue of linking providers, patients, money and connectivity, I reached out to both Diva and to Dale, asking them about what sort of savings. I know it's not savings. It's Anne, help me again. Avoided costs as a result of having
Deferred cost or?
Yes, yeah, avoided costs.
Avoided costs.
Avoided cost.
Yeah. What they were seeing in the case of Diva, for example, for non-emergency transportation, I did get a reply back from them, and we have on our webpage non-emergency medical transportation program and some of the differences that are there between when telehealth is in place and when it wasn't. And then I reached out to Monica Hutt at Dale and asked her for some information about choices for care in nursing homes as compared with in-home, the in-home care issue. And I did get an email back from her, but it's not in a form to put on the webpage, and I'll try and get that translated so we can share that. It was really that they did it over the weekend, so it's very difficult for them to put anything together at this point, and we appreciate that. But I did ask, Anne and I met yesterday with Jen and Maria. Senator Cummings and I met with Jen and Maria to sort of sort out what might work in a proposal on all this. And I think, Jen, so I don't see any hands up, so we'll just move right along. And Jen, why don't you, or I don't know, are you walking us through, or is Maria, or are you doing it together?
Whatever works.
Okay, so it's up to you two.
Jen, you want me to?
Sure.
Start, and you can chime in as we go, or?
Sounds good.
Okay. Okay, so this is one attempt to get a handle on the various connectivity needs related to telehealth, as well as opportunities to coordinate resources and seeking federal funding. So we'll just walk through this proposed legislation, and I think this is in the early draft stages, but it, I think, helps to focus the issues or, some of the areas that you're interested in and trying to get a better handle on. So what this would do is have BPQHC consult with its statewide telehealth work group, the Department of Public Service, and organizations representing healthcare providers and healthcare consumers to number one, conduct a patient connectivity needs assessment in the context of telehealth implementation, which shall identify barriers to patient connectivity, including lack of access to telecommunications or voice service, lack of access to mobile or residential broadband internet access service, insufficient broadband service, including low bandwidth connectivity, low usage allowances or other inadequate service characteristics, lack of network equipment such as routers and wireless capability, lack of end user devices such as computers, laptops, tablets, and smartphones, lack of patient financial resources, lack of patient digital skills, or any combination of the above. And then in addition to identifying those barriers estimating the costs of providing connectivity services, network equipment, and user devices to patients who currently lack them. Then VPQHC would also seek to identify areas of the state that do not have access to broadband service and that are also medically underserved or have high concentrations of high risk or vulnerable patients, or both, and where access to telehealth services would result in improved patient outcomes or reduced healthcare costs, or both. And then identify opportunities to use federal funds and funds from other sources to increase Vermonters' access to clinically appropriate telehealth services, including opportunities to maximize access to federal grants through strategic planning, coordination, and resource and information sharing. And then based on all of that, the information obtained in that subsection A, VPQHC shall pursue or assist healthcare providers with pursuing available funding opportunities and shall assist patients and providers as necessary in order to increase Vermonters' access to clinically appropriate telehealth services. And then the final provision has to do with reimbursement of VPQHC, either through some of that federal funding that might be available, if possible, and then if not, using its existing bill back authority for reimbursement. So that I will stop share now. And Jen, was there anything else that you wanted to highlight or clarify?
No, I don't think so. I think that was good. We were looking to get some words on the page so that you would have something to react to, but recognizing that your interests and your policy goals may be different. So at least this way you can be focused.
Okay. So the charge looks like it's overwhelming. I mean, identifying the states across the states, the needs across the state, to me seems like an overwhelming task. But I think the real goal is to identify providers who have patients who need some type of connectivity, and then help coordinate an application for federal dollars that will achieve that, achieve the goal of connectivity. Senator Cummings.
I'm unmuted. The Department of Public Service has put out a statewide connectivity plan, emergency response connectivity plan as of, I believe, Monday this week. And the Senate and House committees will be having a hearing on that on Tuesday. It's very expansive. The department can identify over 80,000 buildings that do not have access. Access is a fluid term right now. The federal requirements are a speed of 25 down, 3 up. And I know that both the House chair and myself are interested in perhaps doing something a little less ambitious than the entire state, which is dependent on further federal money, something we can do in 6 months. So any information we can get, the first question I have is for folks that are doing telemedicine, especially the ones where they've got devices and can take your blood pressure, and is what speeds are necessary. Do you need to have fiber cable to the house to get a blood pressure reading read back to you? Or does that 25.3 or does dial-up do it? Those would be questions I'm hoping the work group that's there could help us answer, and maybe answer quickly. And the other one is if they know of clusters, not just individuals. Well, there's two. If there's individuals that just need the wire run either to their house or a mile up the road, that there may be funding for. If there's clusters of individuals over a 5 to 10 mile span, that's going to take more expansion, which right now probably takes over a year to get done. We're trying to speed that up, but any help anyone can give the committees that are working on telecom to target whatever money we can get quickly out of the CARES Act to get the biggest bang for our buck would be very helpful. And then we can move into the, how do we get everyone hooked up and how do we get them hooked up at a speed that's useful? How do we, all the other things you have to have, equipment and training and just helping identify those needs in telemedicine would be good.
So, right, so the bill before us really is provider, patient oriented only to those federal dollars that are provider accessible. And, but the question about whether or not the 25.3 is adequate, and I'm looking at Jill and Catherine, if you have a comment to be made about what you understand to be appropriate to access, whether it's 25.3 or 100 or what is it? Do you know? You're both muted. Okay, Catherine.
So I'll jump in. This is not my real wheelhouse. 100 is probably the Ferrari. I think my understanding is 25 is a minimum. 25.3, I think it may be on the light side, but again, I qualify that with, this is not my specialty.
Okay.
Okay.
Helen
but the
Laban
minimum helps.
Helen Laban and Jill also have their hands up. So Helen, go ahead, and then Jill.
For many things, you don't need lightning fast internet to connect. And there's a national technology transfer program that will give you those speeds and the details on it. And I would be happy to get their sheets and send them along. We work with them.
So in the, if this proposal and this policy went forward, then those of you working with VPQHC would have the information you need to help with that patient access piece.
Yes, there's a federally funded program that will assist us in understanding that. And then the Department of Public Service, of course, is going to be mapping speeds and access across the state. There are many, many other unanswered questions, mind you. Yes. But for that part, that's knowable and we can get that information easily.
Thank you. And Jill, you had your hand up.
Yep. I was just going to comment that I don't think you need that level of broadband for telemonitoring. I've never heard that from members, so I'm going to reach out to them. I can tell you what we have at my house is 5 and 1. Yeah. So in Middlesex, Vermont, 3.5 miles from Montpelier. But I think though part of that may be that agencies have nurses who are actually also being in touch with the patients, and so that people can report their own data directly to the nurse. So I think there's some of that. But telemonitors also have a video component, which I'm sure is going to be problematic if the broadband is low.
So yeah, so it would seem to me just having audio visual through an iPad wouldn't need to have more than what you're discussing, 5 to 1.
Well, I mean, that's not enough at my house.
That we don't want it. Yeah. No, I'm not saying that that's something we want.
Yeah, no, I mean, for video, it often doesn't work. So I think you need more than that for video. But I can ask them how they have done that. The bigger issue for us around telemonitors is getting the machines themselves funded and getting the service itself funded. That's the primary issue for us.
Okay. Yes, Catherine.
And Senator Lyons and all the attendees, a critical partner in our stakeholder work group is the Northeast Telehealth Resource Center, who would really be the technical asset in determining those needs. And as Helen and Jill both described, it depends on the types of services and the draw and so forth. But they are an essential contributor to the work group's initiatives.
Yes, and I think as we heard in testimony in our committee several weeks ago, there was at least one provider with patients out in the more rural parts of the state down near Randolph, and all the patient would have needed would have been a cell phone and didn't have it, or all the patient would have needed would have been an iPad and a link from the road to the house. So the issue is identifying, having providers identify folks who need something in terms of their communications devices. Catherine, go ahead. You're muted.
Oh, there we go. Sorry. One of the activities we're discussing with the stakeholder work group is what we're kind of informally calling a connectivity care package, which would be exactly that: a screen, minutes, a Wi-Fi hotspot if necessary, and then education, how to plug it in and connect it, and then how to engage with your provider, all patient-directed and supporting patients' needs based off of a potential prescription from primary or mental health providers. So that's a package of connectivity and access that we're starting to envision and want to take advantage of all the programs as Maria presented to pull that together.
Thank you. You know, Anne Marie, I see your hand. We'll take your question, and then Dr. Green is back with us, so we'll hear his testimony in just a minute. So Representative Christensen.
Yes, I'm listening to a lot of this, when the grants were provided, especially the CARES Act, a lot of deadlines are coming up. It's like use it or lose it. And I'm wondering if we have any so-called shovel-ready things that we can apply for grants. I know the DAs are like handing out iPads and stuff like that. Can we recoup some of that in a quicker fashion than a study committee?
Well, the point is, I think that we need, whatever we do with this legislation, it's really an opportunity to direct some coordination of effort. And because it has to happen yesterday, there's no question about it. And so the issue about recouping, I think we did hear from Maria something about going back to March 13th. So if they've already spent money on iPads for folks, maybe they can go back to March 13th. Maria, is that accurate?
For some programs.
Yeah,
for some programs. So the COVID-19 telehealth program through the FCC does allow for going back.
Okay. All right. So we'll come back to the discussion. Dr. Joshua Green contacted me yesterday to offer some comments about patients who might need some connectivity or devices. And so Dr. Green, welcome. And thank you for being here. And we will listen to your comments.
Thank you, Chairperson, Senator Lyons, and members of the committee. It's an honor to be here. I sent you a written testimony, and in lieu of reading it to you, since you already have it, I thought I would just ask if you had any questions first.
No questions first.
Okay, great. So yeah, roughly in our practice in Burlington, we are about 99% telehealth at this point. And we've seen, I would say roughly 80% of our patients are having issues with the internet connectivity, either through their cell service or through their internet service. video freezing on their end. I know it's not our end because we actually tripled our bandwidth at home so that we would have better connectivity issues. Only about 5 to 10% seem to have difficulty with accessing a video. Those folks tend to be 55 or older on average. Our staff are now actually contacting those folks ahead of time and doing a dry run, so practicing with them how to access. But for the first visit, I would say at a minimum 5 to 7 minutes, I'm spending teaching them how to get onto the video, which we've just had to deal with. I would say maybe 5% are having issues with hardware. That doesn't seem to be the majority. I've even had some patients, people in Vermont are so hardy, they get in their car and they drive to where they know they have reception in order to do a video chat from their car in order to make it work. So people have been pretty flexible. One of our members in Montpelier said that about 50% of their telemedicine visits are by phone because the video is not working at all. So it might be more of an issue in Montpelier. One of our members in Brattleboro says it's at most 10% connectivity issues, but most people are able to do telemedicine fine.
Okay, so the telemedicine piece meaning doing some blood pressure monitoring and related testing.
I'm sorry, no, the telemedicine as far as a video visit.
Okay.
Yeah.
Okay.
Yeah, just being able to talk to them and, if they're at home, having them use the blood pressure machine during the video while we're having the visit. Our biggest concern, because those things have not been as huge, is actually, and while we would really appreciate better internet and cell service in Vermont, it is a major issue. Our biggest concern is that as the COVID pandemic continues and we have, waves coming in and out, we want to make sure that the reimbursement for telemedicine continues, because it's not, even if we think it's safe for them to come in the office, a lot of patients are going to be reticent and they're going to want to continue to be able to be at home safely. And so we're hoping that the equal reimbursement for telemedicine versus in-office visits continues. Otherwise, as private practices, we'll have a hard time financially making it if we go back to getting paid what the previous reimbursements were.
Thank you. That is actually the issue that we were talking about earlier, and we appreciate your comments. Very helpful.
Thank you very much.
Yes, and thanks for being here.
My honor and pleasure. Thank you.
All right. I'll open this up then for questions to Maria or Jen, or if you have a question for Dr. Green, that's also appropriate at this time. All right. And then questions for Catherine or Jill or Helen, who are still with us, and we're glad you're still here with us because you have been working on this for such a long time. I guess my question for the three of you is, I see Bill Lippert's hand is up. So before I ask my question, I'll go to Representative Lippert.
Well, Senator Lyons, as I'm listening, several things occur to me. One is that I'm thinking of what happened with the Small Business Administration funding, which it was gone by the time many people even began to apply. Maria, in several of the programs, she said it's the money's available till it's gone. And, it seems like time is of the essence. What Representative Christensen said, that a lot of planning might be great, but the money might not be there at that point. And so I'm just trying to think about how to accelerate in addition to coordinate and accelerate. This is a very challenging moment. And I think that setting in motion a broad-ranging planning process may be a plan that doesn't really prove to be valuable if ultimately the money's already been spent up by people who are jumping in with shovel-ready programs, et cetera.
Yeah, so I think you've hit on one of my concerns about what we're seeing here for the legislation. I think having a broad, wide needs assessment actually is secondary to having the folks who are currently working to just contact as many providers as possible and say, what problems are your individual patients having and how can we help you access funds? You know, I know that some of the larger organizations are able to do this.
Sure, they have the staff and
They have
capacity
the
to just
staff.
jump.
But it's the person out in rural Vermont who does not. And so, and may not know that not only is there money available for the iPad, but also maybe the $1,600 to get the fiber from the road to the house. So, so I'm thinking that I would say, as I'm looking at the proposal before us, what is most important is the coordination that the VPQHC group can offer to identifying providers and patients, and then linking them with whatever help they need in terms of accessing funds. And then, so linking them with the funds and then providing the appropriate services. Senator Cummings. You're muted. You're muted, Senator.
I'm too good. I do what I'm supposed to. I'm thinking poles and wires is an issue. I mean, it's a big issue and it's going to be done either in smaller clusters right now or in this bigger statewide plan. But what we could get from maybe the consortium is help, and maybe as part of whatever plan we end up with for broadband, we could ask the department. Right now, they have a hotline to call in, and maybe providers could do that, telling them if the issue is people don't have a wire running by the house, people can't afford to connect to the wire that's there, people don't have the equipment in the house, and make that part, you know, a specific telemedicine part of whatever kind of statewide plan we come out with. And then the department has we just hired him, a technical assistance person, really to help the local, communications utility districts, the CUDs, to get up and running. But we could use some technical help, and perhaps use some of this money to help providers get training to people, to get equipment, iPads, whatever, out to folks. That's something that can be done and, you know, more easily assessed, I think, by providers. How many iPads do they need? Right now, most of the cable providers and cell phones have special offers, and I think they're up on the website, of 3 free months. If you've been disconnected for lack of bill payment, you can get back on. They vary, but there's a lot of programs on their end that if there's a wire there and you've got the equipment, you can get back on. People may not know that, and providers, we might be able to get that information to providers.
So,
You know, it's just a lot going on, and it's got to go on quickly.
right. And so I think the more, the simpler we can keep it as far as the provider-patient relationship, And then having the group that's already been looking at that relationship for telehealth, the faster we can put something in place, and then they can link in with the Department of Public Service. I would hate
Yeah.
to have to wait for the full-blown statewide 10-year plan. So,
Well, no, this is an emergency plan.
okay, all right,
They're
okay,
it just depends on future money. So
yeah. Oh,
we're trying to do present money and do a few, I think, smaller clustered things.
Yeah.
And if we can, I have a feeling that education and telemedicine overlap. We know where there's no poles and wires, and then trying to get them out there. And they tend to be the rural, poorer areas.
one
And
of
then
the,
maybe we can help Jill Olson get a line up her road.
right,
Still
I
Road,
just-
Middlesex, Vermont.
have a bug.
Hill Road, Middlesex. Okay, are you closer than a mile to the next pole?
We're 1 mile from the pole.
There's money there for that now.
All right.
There you go.
I think we're all feeling the pressure of time and wanting to access the resources available. Catherine, go ahead.
Just to add that we feel those deadlines as well. And while we don't have shovel ready, we have some concepts that will be discussed tomorrow. I'll know a little bit more after tomorrow's meeting, but we also have a series of work groups planned to be able to divide and conquer the workload. We've got a charter that's very rough, very draft, not quite ready for prime time, but we're a little bit down the road in some of the planning. And when we get those documents cleaned up and fluffed a little bit, we'd be very happy to share some initial planning with you.
Well, my question would be, while you're doing that planning, is it possible to begin to reach out to individual providers or identify them as a group? So that this all, and then to link them in with the funds that they can apply for, because in most of these cases, unless I'm wrong, Maria, it's really dependent on the provider
No, it could be a consortium.
applying.
Yeah, it depends. It
Okay.
depends on which funding you're seeking.
Sure.
A lot of them are
Yeah.
the healthcare provider
Yeah.
does submit the grant, but it can be other state or local entities or groups of
Okay.
providers and
Oh,
networks.
that's good. I mean, that really helps. Jill, you wanted to say something.
Yeah, I just want to caution, some of this conversation makes me worry that we're actually just adding a layer instead of making it go faster. So I just want to remind you that we all have our national associations who help guide us in terms of what federal dollars are available for our particular industry and the work that we do. And that's really where I look to first on federal. And so I'm not going to stop that work in terms of figuring out if there's anything there. And I think that's going to be faster probably. Because really, as I've said, for home health anyway, our biggest issue are the poles and the wires, the infrastructure. We cannot get involved in that. I mean, we need it, but we can't help assess that. We don't have the bandwidth for that,
Right.
As providers.
But that's an ongoing issue.
And
I
that's
mean,
an ongoing issue.
That's a pre-pandemic concern.
Yes, exactly. It's just exposed by this
Poles and wires
pandemic.
is
So
nice.
I just want to, I'll be really interested to hear the meeting we have with Catherine tomorrow, but that is my caution, that I just want to make sure we don't, add a layer that isn't going to add value.
Yes, good point. Helen, you're muted.
Yeah, just to build on what Jill has to say, I think it's an important distinction to make, that I don't wake up and say, how can Vermonters have access to telehealth? I say, how can they have the best access to healthcare and the best quality healthcare? And often the answer involves an element of telehealth, especially now, but just in general, it does. So I think it is important not to send providers down the road of chasing telehealth for its own sake, but to be sure to build a structure where we can position it as part of the integrated toolbox and how do they serve Vermonters.
Exactly. I think that's so much on target. I think for us who have been dealing with the pandemic, one of the early concerns we heard it was about access to telemedicine, telehealth, telephone. And I think we have to keep focusing on the emergency that we're under, and especially for vulnerable patients. As this continues and we see surges, we're going to, I mean, I personally think it's really critically important to have people connected. So. Any other questions or comments?
I wanted to make one more comment, which is a little bit off. Well, it's still on target, but sometimes what we should be doing is not telehealth. What we should be doing is sending a nurse into the home. And so, because people actually do need to see someone, but they need to see them at home because it doesn't make sense to drag them to an office. And so I just don't want us to get so wrapped up in telehealth that we forget that we maybe should actually be expanding some of that in-home service, which makes extra sense in a global pandemic, right? Much safer for people to get care in the home than to go places if they don't need to. So I don't want that to get lost in the focus on doing things remotely. We are seeing people who are getting very weakened by just not getting rehab services. So we're starting to go back in to do more of that rehab. There's only so much you can do on the phone.
Right, thank you. I don't think we're trying to replace the personal contact or the
well,
personal.
It may be the moment to expand some of it, is what I'm
Right.
saying, where there isn't currently coverage for it for us to do or regulatory allowance like that. I just don't want to lose sight of that path because
Good.
it's got to be part of this.
Yes, very
Yeah.
good. Catherine.
Just maybe a final thought to reiterate what Jill said earlier. We're not aiming to double do. We're aiming to leverage other initiatives, national resources, leverage and align, and bring those already established best practice into our work groups and our initiatives. And that goes for exactly as Jill described, that patient initiation and where it is and is not appropriate from a provider-driven, patient-centered perspective.
Thank you. I think that is, we all agree with that perspective. And the goal of what we're talking about now is a provider-driven access to telehealth, telemedicine, telephonic devices and connectivity. And we know that there are many other issues out there, including increasing the workforce, having a workforce trained, and all of those other things. So going back to John Muir, if you try to separate out one thing, you find everything is connected. So, so thank you. I thank you for that. My guess, the question for committee members, and I think we have a quorum of both committees here, but is it, shall we continue to modify the proposal and narrow it down a little bit so we maybe get something out pretty quickly? It's a question. Yeah, all those in favor, a straw poll. So do you think we should go ahead with this is what I'm saying? Because I heard a lot of comments.
No.
Yeah, yes, I
Okay.
think it's important.
Okay, good. Yep, thank you. All right. Okay, and
Where's my
Senator
crystal?
McCormick. You're muted, Senator.
Did Ann say no?
Ann's not sure. Oops.
You're on. You're on.
I'm on. I'm not sure. We've got a major poles and wires issue going. We've got a whole consortium of folks that are dealing with telemedicine. DFR is going to be dealing with the insurance companies and the providers because all of these telemedicine things are kind of time limited. I'm not sure what we're adding of value. And
So I think
I'm
Senator,
just not sure.
yeah, I understand your perspective, having dealt with the statewide plan and planning process. I think this is a very narrow opportunity for us to access federal dollars to provide, to give it to providers and patients. It's not going to solve the full broadband connectivity issue at all, but it might relieve a few people of a burden and provide access to care. Senator Ingram.
Well, and all due respect to the poles and wires folks, we've been talking about this for a decade at least, and here at least we have the urgency of this healthcare crisis to make the argument that we need to now to provide adequate healthcare to hunters. So it seems like it seems to me like we should seize the opportunity and seize the availability of new federal funds to really push this through and not rely on the same old that we've been relying on, which hasn't actually produced results yet.
Jenny.
Sure. I've got Senator, I have Senator McCormick. Is your hand still up?
Sorry.
Okay. I have Senator Westman, then Senator Cummings. Go ahead.
So just in response to what Senator Ingram just said, we did put out two grants last year, and they were just awarded to Vermont Electric Co-op and to Washington Electric, which would allow them to investigate whether or not they could move into moving fiber optics out to their members. And they're in probably 80 to 90 towns that are the most rural in the state. And the problem and they own the wires and they own the poles to do that. The problem with them has been and remains, the state won't allow them to use any of their resources that are electrical to do anything with their poles and wires. And they own the right of way and they own. So in some respect, I think we need to recognize that we just put those grants out there within the last 2 months, and they aren't your traditional, have been working on this because we haven't allowed them to. So there is a piece of that I think we have to look at, because they own poles and wires and they own right of ways. And it would seem to me in those most rural areas where they are, that they might be good at this. So we should keep that in mind.
Thank you. And they also might respond differently if they knew it was a vulnerable patient at the end of the wire. Senator Cummings.
Okay. I don't think it's respond differently. There literally was a law that said they couldn't do it, and we removed that. And that is very active. I guess what I'm trying to remember is, are we trying to help providers, and do providers want our help? Because I'm not sure I'm hearing that in accessing public funds to get iPads reimbursed.
Well,
because I think that's something that we could do, and we might be able to work with them in helping to provide a training packet for their patients. I told you the other day while we were having this discussion online here, my husband was downstairs trying to do a regularly scheduled consultation with his doctor. And I hadn't been able to get audio on his tablet the day before when we'd had a family meetup. And so I'm sitting here listening and trying to figure out if I got to take my iPad downstairs. UVM Medical Center has a whole tech staff, and it took a while, but they got him hooked up. I doubt that some smaller hospitals can do that. And so I guess what I'm trying, to define is, I'm not sure if we can set up part of state government or a consortium that will help providers write the grant and reach out, that would be helpful, I think, to tell providers they should be doing it at a time when they're struggling to stay afloat. I'm not sure is helpful. And I don't think I've heard that it is helpful.
Well, it is helpful. We heard that early in the session from Gifford, and we also heard it just today from Dr. Green, and we've heard it from others. But I think the important point is that there's federal dollars available. Not all providers know it's available, but they do know that their patients need help and need, as you said, some education and some devices. So it's a beginning, and I think the coordination of the grants and accessing information, that's really the key piece of all of this for me. So Catherine, I see you shaking your head. All right.
Yes, absolutely. And the idea would be to almost have a fillable form, or for a practice to have just the opportunity to plug your name and address and your TIN into an application, and really just make it so easy, and to pick up the role of a coordinator of a consortium of applicants as well.
Okay.
Okay, that's helpful. All right.
Is that what we're talking about doing?
Yes, we are talking about that. We're talking about coordinating and administering the efforts in this section, which is
Okay,
little c at the bottom.
Who's we?
Senator, it's in the little piece of legislation that Maria presented to us. It's the VPQHC and statewide telehealth work group. And then
Okay, so it's provider work groups that would be developing this.
Yes.
Not the Department of Public Service or Financial Regulation.
No, and
Okay.
but they'll certainly have to have some connection with the department. There's no question about that. And it might actually help the department. As you said, they need to know 25-3 or 25-25, what, so there'll be some linkage in there. Yes. Other questions from the committee? Maria, you've listened to this very interesting conversation, and maybe we can circle back and modify the language, and with the help of Helen and Catherine and Jill, and we'll try to sort that out so we come up with something that represents what we've been talking about.
Sure.
We're not about to go and write the 10-year plan for poles and wires. It's not our job.
No.
Unless Senator Cummings would like us to do that.
Don't tempt me, but no, I just want to make sure that we're clear who we're asking to take responsibility for this is, and that if it is in fact the provider groups, that they know that's what we're doing and that they feel that would be helpful.
Thank you. Yep, you got it. We're good. My question of the provider groups right now is Vermont Care Partners listed as a member?
Senator Lyons, they are not at the moment, but that was my 3 a.m. thought about 2 nights ago. So yes, they will be.
That's excellent. Senator McCormick, your hand is up. Is it up?
I didn't intend it to be. No.
Okay.
He's just waving.
Okay. Representative Lippert. Your hand is not up. Any comments or you're good? You're muted.
It seems to me that the poles and wires issues are a separate issue. That's that's going to be dealt with separately. I think to conflate the two is a mistake, and they're separate. My concern is what can be done efficiently to actually try to access any of these funds. And as I'm listening, I mean, I want to reflect on this as I'm listening, I think it's probably unrealistic that small providers are going to apply for any of these federal dollars. They don't have time or the resources to do that. I think we're going to have to turn to some kind of consortium to actually do the application, or to professional groups who are representing a group of providers, and getting maybe the first step really. And we're before the money's gone.
Yep.
Just getting the information out to people is and so that the professional organizations, whether it's the VNAs or the DAs or whomever, are more likely to have the capacity to actually seek out, or the Vermont Medical Society. I'm not sure who exactly, but I don't think it's realistic that a provider in Greensboro is going to be applying for federal funds. I just don't think.
Exactly. That's the issue. Yeah. Okay. Well, we've had quite a robust conversation. I'll circle back with Maria, and Maria will be reaching out. If you would like to be reached out to, let her know. But in the meantime, it will be to Catherine and Helen and Jill, who have been very engaged in this. And thank you all. We have just used up some of our goodness. We are overtime. I think we were supposed to go until 12 today.
We could pretend it was 12:15 and you could still say you stopped early.
Wait, that makes sense.
3 minutes.
Listen, thank you all. So we do not have a meeting tomorrow, committee. We are meeting on Tuesday after the floor session. And in the meantime, we'll be working on the two draft proposals before us, and we'll try to get to closure on those as quickly as possible, because I do feel a sense of urgency about both of them.
And could I say for the House members, we will not be meeting tomorrow, but we are going to be meeting as the House committee separately on Tuesday, I believe from 11 to 1. I'm not sure that's been distributed to House members yet.
No.
There was some confusion about what time was available for us. But I think Demis will be letting you know officially shortly. But I think it's 11 to 1 on Tuesday, just the House committee, and then jointly again on Thursday with Senate Health and Welfare. But the details will follow shortly, hopefully tomorrow at the latest.
Okay, that's good. And I think we'll be able to meet at 10 o'clock, Senate folks, so on Tuesday. So I'll see you all then. In the meantime, get outside before the cold weather.
Let's get outside.
Before the polar vortex.
All right, thank you all. Take care.
Thank you,
Jenny?
Senator Lyons.
Yes.
Jenny,
Yes.
Brian,
Nellie,
is Ann on still?
no,
You're gonna take us off of YouTube?
can we go on live, Nellie?
I'm ending the live